Okay, well, welcome everyone. Those of you in Zoom land, thank you for joining us, and we have a great crowd here. Those that are not here, we miss you, and we just were, because you know how I love to hug people. This is Tony Montgomery. Tony is with Assured. I always want to say Murray, because that's how I've been in this company for years and years, right?
Well, technically still both.
Okay,
it's a combination.
Good.
I answered both.
You answered to both. Tony, I met Tony a couple months ago when I personally, and I know you're all shocked that I personally have experienced this. You thought I was older than I am. And for those that are still contributing into the Medicare insurance, I want to say thank you. I appreciate your assistance with my premiums. So that's a twist on that. But anyway, Tony's been doing this for 15 years.
Correct.
And he's been here for 12. And when I met him, I'll tell you what, I felt like I was doing a disservice that I hadn't gotten this underhand earlier, because it's a very confusing topic. So I'm not going to say anymore. We're going to let Tony do his thing.
Okay, well, thank you very much. This is going to be very informal. So for any questions that pop up from what I say, please feel free to stop me, ask the questions as we go along. Do we have the capability of taking questions from the Zoom calls? Yes. All right, so, raise your hand and you'll let me know what your questions are. I'll be more than happy to answer whatever I can. All right, my name is Tony, as you said. I've been here at Murray Insurance 12 years this month. In January, Murray got purchased by a company called Assured Partners. So you'll start seeing the Murray name less and less, and Assured Partners more. So that's why you see the card that you do. My contact information, though, for both still applies. Now, what we're going to talk about is the exciting world of Medicare. Looks like some of you here might be getting close, but my job is to help answer the questions for those who are soon to be in Medicare, are on Medicare, or maybe are just looking for information regarding your parents that you help on Medicare. It doesn't matter. I'm more than happy to answer any questions for all. So let me start by asking, who knows, what is it that you need to do in order to qualify to be on Medicare? Who knows what that is?
65.
Or 65.
You have to have 40 quarters of
that has more to do with what Medicare costs, but so far we got a 65.
But you have to sign up long before you're 65, so not to have any, not long, for at least 30 days, I believe, to process.
Well,
For
we'll talk about that. Okay, well, that's the income part, or what it costs part. Yes, when you turn 65, you are eligible for Medicare. The first of the month in which you turn 65. Unless you so happen to be born on the first of the month, then it's the first of the month before that. There's other reasons why some people go on Medicare as well. It could be if you have Lou Gehrig's disease, or ALS. You're entitled to get the same Medicare at any age. End-stage renal disease. Who knows what end-stage renal means?
kidney.
Right. You have kidney failure, you're entitled to Medicare right away. And finally, if you've been on Social Security disability receiving income due to disability for 24 months, you're also entitled to the exact same Medicare. It's not just for older people, okay? My youngest client was 22 years old on Medicare. Now, I say was, he had kidney issues, he didn't die. He got transplanted, he's doing very well, but for a while he was on Medicare. So it can be for younger people as well, okay? Now, just because you're turning 65, are you required to go on Medicare?
No.
I see a lot of shaking heads of no. What about that penalty, though? You hear about a penalty if you get Medicare late, don't you?
But if you're working and covered under a group plan,
Exactly.
you have your own special.
Keep in mind, those who are 64 and a half or older, you get a couple of pieces of mail about Medicare every now and then. A lot. Unfortunately, that never stops. But keep this in mind. All that mail that you get, no matter who it's from, it's not designed to make it easier to understand. It's not designed to help you make a choice. What it's designed to do is elicit a phone call to them so they can tell you how good they are. A lot of these companies, a lot of the mail that you get tries to frighten people Well, with that late enrollment penalty issue, they'll tell you, if you don't get your Medicare when you're 65, oh my lordy, you'll have a penalty and you're in trouble. But always, there's that little caveat, with teeny little letters at the bottom that says, unless you have other credible insurance. Credible. What that means is you could have insurance through an employer. That could be considered credible. So as long as you have insurance through an employer, there's no requirement that you sign up for Medicare at all. Because when you do decide to go on Medicare at a later date, you will be asked, it's okay, from the time you turn 65 until now, age 70, what was it that you were doing for health insurance at this time period? We want to charge you a 10% penalty for every year you waited unless you can prove to us you had other credible insurance instead. It's a form that I have that I give to you that goes to your HR department. They say, well, yeah, he was on our insurance all this time. Medicare says, cool, as long as he had something, no penalty for you. So you're right. You do not have to get Medicare at all. Yes.
What about, I'm on my wife's insurance now,
Right.
and I'm going to be turning 65 in March.
Right.
But don't you have to sign up for Part A at
No.
least?
No, you don't have to do anything.
You don't have to.
Probably you're going to want to.
Yeah.
You don't have to. I'll explain that in a second. You might want to look too, because some group health plans are written such that, yes, we'll cover your spouse under our plan, but if they become eligible for Medicare, we're not any longer. Or we will, but we'll only be secondary behind the Medicare. You might want to find that out, because that will determine whether you have to go on Medicare, full Medicare A and B, or not at all. Okay? Any other questions about getting into Medicare first? Now, when you do decide to get Medicare at a later date, that constitutes what's called a life event that gives you permission to leave your group plan at any time of the year. It's not going to be contingent upon when the group renews. It's not going to have anything to do with Medicare's annual enrollment period, which is upon us here shortly. You can do it the first of any month you want after turning 65. Now, what we're going to do is we're going to go over the charts on the left-hand side. Medicare has 4 parts to it. They call themselves parts. There's an A, a B, a C, and a D. We're going to go over those a little bit and kind of talk about what they do, when you need to get that, if you don't have to get that. But of course, we start at the beginning. Medicare Part A. Medicare Part A, if you look underneath the blue line, Medicare Part A is called hospital insurance. What that means is it covers you if you get admitted to a hospital. That's it. Only if you get admitted. Also under the blue line, Medicare uses the word if you're confined. I'll tell you, I don't like using that word when I do a seminar at a retirement community. I start saying the word confined, it freaks them out, right? We know it is inpatient care. Now, this goes back to what one of you were starting to talk about. How much does Medicare Part A cost? Who knows?
No.
Sometimes I hear people say it's free. Not free. It doesn't cost you nothing. It does cost you 0. What does that mean? What it means is all the years you've ever worked, when you had that deduction off our paychecks for Medicare, you paid in for Part A for a long time. The rule that one of you started to say, as long as you work at least 10 years or 40 quarters, or you paid in Social Security, you've already paid ahead for the Part A. I have a little thing there, the second line in blue, $259. That's how much Part A would cost if you hadn't worked at all. I had a guy call me today, 72, he's from Britain, he never paid anything in his Social Security. He can get Part A, but he's got to pay for it because he can get the opportunity to have it paid in Social Security on his paychecks. So for most people, Medicare Part A has no monthly premium. 15 years, I might know 2. This is out of like 10, 12,000 people I might have talked to. Doesn't happen often. It's not free, you pay a lot for it. And that's part of what drives the whole Medicare conversation as far as what the coverages do and how they work based upon the amount of money you've already paid in. Now, Medicare Part A, called hospital insurance, what it covers for you, and this is that top gray block on that chart, it covers your hospital room, the food, the nurses, and the medications you get. That's all. It's your room and your board. Doesn't cover doctors, doesn't cover tests, doesn't cover surgeries. It's your room and your board. Now, when you go on Medicare, and if you get admitted, you are responsible for a deductible. That's that number in the right-hand column. As you're familiar with, a deductible, that's what we pay for our health insurance before our insurance even begins. That number this year is $1,484. Numbers can change in January, they usually do a little bit. But this year it's $1,484. Now, if you get admitted to a hospital, you are responsible for that $1,484. But what that gets you, if you look on the left-hand column, it gets you anywhere from 1 to 60 days worth of that hospital room, food, nurses, and drugs. You may only be in the hospital 3 days, you gotta pay for 60. You may be in the hospital 2 weeks, you have to pay for 60 days. You get admitted, you're on the hook for that $1,484. Now, the thing is, you might have to pay that deductible multiple times per year. Yeah, multiple times per year. The thing I always get right after that is, well, does that mean you got to pay that deductible every time you go in? No, not that either. Here's how it works. We'll pick on you first, since you're right across from me. What's your name?
John.
John. John, you go on Medicare January 1. Well, you said March, right? March 1. March 3rd, you were so excited about turning 65, you had a crazy party. You're in the hospital. So you're going March 3rd, you are on the hook for that $1,484. But what you just bought was 60 days worth of that room, food, nurses, and drugs. You bought March 3rd to April 3rd, April 3rd to May 3rd. You're only at 3 days. Nice thing about that is, if you're in 3 or 4 days and you come home, and then due to complications or something different, you get readmitted, you do not need to pay that all over again. You can go in and out of the hospital as many times as you need to during those 60 days, even if it's unrelated, and don't pay it again. But what if you go in March and you pay that? Then you come home, you're home 6 months. Go back in September. So now your 60 days are over, you got to pay it again. So if you're really unlucky and you go to the hospital every 2 months and a day, you got to have at least 1 day between to be home. You can pay up to 5 times per year. That's why these things called Medicare Supplements and Medicare Advantage plans exist. Their job is to help cover that expense. Understand? All right. Now, we're going to skip down to the middle of that page. Medicare Part A also covers something called skilled nursing confinement. There's our confinement word again. This is the rehab that you may get after a hospital stay. Think of a knee replacement, shoulder surgery, maybe a stroke. You're staying in a skilled care center, Medicare Part A, and this is in that gray block. Medicare Part A says they will cover the first 20 days of that skilled care for you, no charge. Now, if you need more than 20 days, you can get it, but days 21 to 100, you're going to have a copayment of $185.50 per day. That could really add up. Medicare Supplements pay that in full. Medicare Advantage plans kind of to a point. Next block down, home health care. That's similar. You had a surgery, say you got the knee replaced, but you're well enough that you can go home. You don't need the expense of staying in a skilled care center. You can be home, but you still need your therapy. You're seeing an outpatient clinic, you get therapy, maybe a nurse comes to the house. Medicare understands it's less expensive for them to cover you that way than to keep you in a skilled care center, so there'd be no co-payment for that. Finally, the bottom block, Medicare Part A is also the part that would offer the hospice care. If you're deemed to have a terminal illness, if left untreated, would take your life within 6 months or less, hospice replaces the Medicare Part A and pays all the expenses. Any questions about what I said?
Would that be in your home or in hospice?
In hospice. Well, no, if hospice comes to the house, yes. If they're enlisted to come to the home, that would also pertain. Now, we talked about whether you should get A or not if you have other insurance. Well, here's the deal. And it has to do with the number of employees you have on your group plan or at your work. So let's talk about you guys, you mentioned it. If you got Medicare and your employer had 20 employees or more, and the Medicare would be secondary behind the group insurance. If it's a smaller group, the Medicare would be first, the group plan would be second. So your employer, is it more than 20?
Mhm.
Okay. So if you were to get Medicare, A or A and B, it will work as secondary behind the group plan. Same thing pertains to him. Okay? Now, specifically, should you get the Medicare Part A? Well, in your case, you might as well. You've earned it, might as well take it. And it will sit there as secondary behind your group insurance in case you need it. Hopefully it doesn't need to do any work, but it's there if you do. Now, if you're the employee, should you also get the Part A? Maybe. Yeah, you've earned it, and if you take it, it'll be secondary behind the group plan. But here's the caveat. If the plan you're on at work is the high deductible plan with a health savings account attached to it, you can't have Part A and the HSA at the same time. So if you're contributing to an HSA, that's pre-tax money off your paycheck. Medicare doesn't allow you to have the entitlement of Part A and have tax savings as well. So that's one reason that you avoid the Part A. Okay? What happens is if you have Part A and you still contribute money into your HSA, if the IRS catches on, right now they might get more resources to do that, who knows? They will look at you and they say, okay, for those 5, 6, 7, 8 months, you've been paying money into your HSA after you've had Part A, you should have been paying income tax on that money. Pay it now. Okay? But if you're not on the HSA or you don't intend to go on one, then you might as well get the Part A as well. Okay? To get Part A, 2 ways to do it. You either call the Social Security office, they're not open yet since COVID. Not yet. But you call them. And you say, I want my Medicare Part A. You're entitled to it the first of the month in which you turn 65. Or, as I advise a lot of people, set up an account for each of you on your own at ssa.gov, Social Security's official website. It's a great site. I have my own. I'm 58, so I got a little ways to go with my Medicare, but that website will show you kind of like what you would get once a year in that statement from Social Security income about what you might collect. But it's kind of neat because you can see, okay, if I start collecting at 67 and a half or 67 and 12 months, it shows you what you'll get. But from that website, there is a button where you can apply for benefits, which either means Social Security income, which you don't have to take right away. You don't need Social Security on Medicare. You can apply for Medicare Part A right there. Pretty simple. Okay? Any questions so far? All right, let's go to Medicare Part B. Medicare Part B, and you'll see this underneath the blue line on this page as well. Medicare Part B is going to be called medical insurance. Remember, Part A is called hospital, Part B is called medical. It's a broad term, but what it means is it covers everything not involving getting into a hospital. Now, eventually, we all need to get the Part B to go along with our A. Eventually, the A and the B together will be our primary insurance. Anybody you know on Medicare. The last 51 years, parents, grandparents, friends, relatives, Everybody starts with the Medicare Part A and Part B. Now, if you're still on an employer plan, you might not want to be right away, and I'll explain that in a bit. Let's talk about what Medicare Part B does. Look up right underneath that dark blue line. Medicare Part B, this is the part that covers all of your doctors. Whatever your family doctors or specialists, surgeons or anesthesiologists, proctologists, gynecologists, ophthalmologists. I think it's got O just after it, it's going to be the Part B that covers it. Even if you're admitted to the hospital, it's the B that pays the doctors. It's the B that does the outpatient care. Remember, Part A only covers you if you get admitted. That's it. It's the Part B that will do the day surgeries, the overnight for observation, emergency room stuff. Part B. Part B does any tests that you need. Blood tests, urine tests, CAT scans, x-rays, MRIs, colonoscopies, you name it. It's the Part B that covers those. Supplies, if you look on that, I think it's the 5th grade block. Part B covers supplies, also referred to as durable medical equipment. Durable medical equipment. Who knows what I mean by durable medical equipment? Any ideas? CPAP. Not a lot of people think of that one. And the tubes and the filters that go with it, and the oxygen. Anything else?
Walkers, wheelchairs.
Walkers, wheelchairs, right. It could be as small as diabetic test strips or monitors. Canes, walkers, wheelchairs, hop around. It could be hospital beds or new knees, pacemakers. Any device or equipment you need in your health care, it's the Medicare Part B that helps you today. Look down on the left-hand column. Part B also covers blood and immediate transfusion. Okay? Blood and immediate transfusion. Now, also Part B covers some drugs as well. Remember, I told you Medicare Part A covers the drugs no matter what they are if you're admitted. Part B covers some drugs too. Now, look closely at that bottom gray box. What it says there in that space is Medicare Part B covers drugs that are normally administered by a doctor or hospital. It's kind of weird. What does that mean? It seems more legal than it does medical. What that means is Medicare Part B covers drugs that we can't give to ourselves. Think of like an injection, flu shots, chemotherapy, dialysis, shot in your eye for macular degeneration, shot in your knee for joint pain. Any outpatient treatment you need, go to the emergency room. The IV, the meds they give you there will be covered under Part B. Get the colonoscopy or any test like that where they need to knock you out. That drug they give you for the anesthesia would also be covered under Part B. Understand? Some of the expensive meds. Now, Medicare Part B does have a monthly premium. If you look 2 lines under the blue line, it costs $148.50 per month. That's what most people across the country pay for Medicare Part B. Normally, it's deducted right off your Social Security check. If you're collecting Social Security, you don't have a choice to take it right off of that. I did say you can have Medicare without Social Security. Well, how does that work if you don't have a check for them to take that off? Well, what happens is Social Security will send you a bill for that every 3 months. And then, when you start to collect Social Security income, Medicare will know it, they'll be told. And they'll start taking it off your check once a month automatically. Okay? Now, there are 2 reasons why some people can pay more than $148.50 than other people. That first one is that the enrollment penalty we talked about. If by the time you enroll in Medicare, say it's age 70, you will be asked, like I said, okay, from the time you turn 50 until age 70, what were you doing for health insurance? You get that letter from your HR department that says, well, it was on our insurance. Excellent, no late penalty. But what if you didn't have anything? What if you chose to not take any insurance because you never go to the doctor? Medicare will charge you a 10% penalty for every year that you waited to sign up. That penalty never goes away. So if you work to age 70, you're paying 50% more than anybody else on Medicare. Doesn't happen that often, but it happens. The other reason they can charge you more than the $148.50 is because of your income. Medicare and Social Security all talk to each other. So does the IRS. They get involved too. So when you sign up for that Medicare A and specifically the B, you'll get a letter saying your Part B is going to start. We're going to charge you $148.50, but we're going to check with the IRS, see what they have to say about it. And if your income is high enough, they may say, okay, we're going to charge you a little extra. Now, on the right-hand side, there's 2 pages, the second page. This chart here, income-related monthly adjustment amount. Are you able to get on that for the Zoom people? Excellent, thank you. This chart right here. They look at it, you look on the right-hand side, the left-hand side, they will look to see if you file taxes individually or jointly. You have different benchmarks. But you can look at the joint section. You can see there, if as a couple you make $176,000 or less adjusted gross income, or an individual $88,000 or less, you're paying the same $148.50 as everybody else across the country. However, if your adjusted gross income is more, you can see how much more they're going to charge you for that Part B. This is an important chart to have when you're doing your planning, because if throughout your retirement, if you're close to one of those benchmarks and you decide to take a disbursement from your 401k that is taxable, it could put you over to the next number. And you're settled with that higher monthly premium for the whole year. You might say, okay, well, I'm going to take $2,000 out of my 401k. She'll say, no, wait till January when it's in the next calendar year. Because of that, that's what you look at.
So it's done in January of each year?
Well, they cross-check with the IRS. The IRS does taxes January to the end of December. So it's based upon what the IRS tells Medicare. So in other words, right now, we're not in November yet. If I was to sign up for Part B, they're going to look at my 2019's tax return. Well, in November 1st, person, they automatically start looking at 2020s. I haven't filed my 2021 yet. So that's automatic. Now, if I have retired, that's why I'm going to Medicare now. The IRS looks to this, they call Medicare and says, well, in 2019, he made $89,000 a year. What he made was $1,000 more. We want to charge him $207.90 instead of $148.50. And I'm going to say, I get a letter and it says, okay, well, I can challenge that. I can appeal that. And I'll say, well, yeah, you're looking at what I made in 2019, but I'm retired now. I'm only making $48,000 in my investments and my Social Security income. Medicare says, we didn't know that. But thanks for telling us. Okay, we'll reduce it down to a lower amount. You can appeal it. It's not like events like that. You don't have to wait. I don't have to wait till they get to look at 21's taxes. I can appeal it if I had a life event like that. But that's why some people pay more. It's not permanent. So if I indeed was subject to the $207.50, doesn't mean I got to pay that the rest of my life. It's that when my income is provable to be lower, can I get it reduced to the next lower amount? Understand? Okay. So normally it's paid for through your Social Security check automatically. If not, Social Security will send you a bill every 3 months. You'll come across a lot of people on Medicare like to talk about their Medicare for some reason. It's okay. They like to talk to you about, I don't pay anything for my Medicare. A lot of people say that. Everybody pays. It's just that people have had it coming off their Social Security check for so long, they forgot. They're just used to what shows up in their bank account after. Unless you're on Medicaid and you get the state to pay for it, everybody pays it. Understand? Okay. Now, let's go back to that Part B chart. We know it has a monthly premium. We'll say $148.50 for now. Part B has its own rules of how it pays for things. It has a deductible as well. But unlike the deductible, which is very large and maybe multiple times a year, the Part B deductible is only $203 for the entire year. That's it. Just once. That's pretty nice. That's lower than what you might have on a group insurance plan. And the rule of Medicare has always been for 51 years, after that deductible is met, this is third grade blocks, Medicare covers 80% of the bill and you are on the hook for 20. That's what Medicare is and always has been, an 80-20 plan. Again, Medicare Supplements and Advantage plans, their job is to help cut into that 20%. We'll get there. Now, Medicare is a federal plan, meaning the little red, white, and blue card you get looks the same, it's going to cost the same, it's going to work the same no matter where in the country you go. Medicare A and B does not have networks. There are no PPOs, there are no HMOs. It's just Medicare. You don't need referrals. You can go over wherever you want to go. Okay? Now, I gave you guys pens for a reason. I want you to take one of those pages, turn it up. Well, I guess you can. Take one of these pages, like the one with the income on it. Turn it over. I'm going to give you 5 things that Medicare Part A and Part B does not cover, other than 20%. It's going to be what Medicare does not cover. All right, number 1. Medicare Part A and Part B works the same no matter where in this country you go, but other countries don't have to take it. So put down abroad. If you go abroad, you might want to find out if we're going to accept Medicare or not. If they don't, there are inexpensive little travel plans you can get from your insurance travel agent to get you there and back. Number 2, prescription drugs, RX meds, pills that we take ourselves. Yes, we have to go to a doctor to get the prescription filled, but we give these to ourselves. We're not utilizing a doctor to get them put into us. There are other parts of Medicare other than the A and B that help cover these. We'll get there. Long-term care, that's the third thing. Long-term care. You become a permanent resident of a retirement community. Medicare is always there to cover your medical expenses, but not your room and your board. Now, some of those who live in a place like this have exhausted their assets. Medicaid can step in and help pay for them to live there. Medicaid sounds like Medicare, but Medicaid is the financial assistance. Medicare is the health insurance. 4th thing, write down dental, vision, hearing. And very specifically, write down next to it, routine. What I mean by that is Medicare Part A and Part B does not cover your eyeglasses, eye exams, dental cleanings or x-rays, hearing aids or hearing tests. But if you have a disease or an injury that affects the mouth, ears, or eyes, not routine, and you're seeing a doctor, ophthalmologist, Medicare covers those things, just not the routine stuff. Cataracts, glaucoma, retinopathy. You have diabetes, and they test your eyes every 3 months. That would be covered under Medicare. Now, for those who are going to stay on a group plan, and in this case over here, if you put him on Medicare, group plan, do you have dental vision through your employer? It's probably more often not separate from your health insurance. You could look to see if it made sense to move him on Medicare for the health insurance, but let him stay on your dental vision because Medicare doesn't do very good with that. And even after you retire, you're permitted to stay on your employer's group plan via COBRA, the dental vision. COBRA, you know, it's expensive insurance. What it means is, it's a law that was passed that entitles you to stay on your health insurance or dental vision insurance up to 18 months after you leave, as if you never left the plan. However, your employer no longer pays their portion of it. That's why it seems so expensive. It's not really a whole lot more expensive than it's ever been. It's just now you're paying all of it. I'll tell you right now, most employers don't pay hardly anything towards the dental vision portion. So it would be probably pretty darn cheap. And guys like me can offer separate dental vision plans, but it's usually always cheaper if you can stay on it through a group platform. At least until you retire, and then 18 months after. And then, if you want dental vision, then we can talk. Okay? And the fourth and final thing is something not medically necessary. Not medically necessary. Medicare does not cover that. You're not going to get a facelift with Medicare. You're not going to get gastric bypass surgery because you only need to lose 100, 200 pounds. You're not going to get a hover around because you want to get down to the point. But here's how doctors and Medicare interrelate. Doctors don't like it so much because they don't get paid what they feel they should. We all know that. But on the opposite side, it is so much easier for doctors to get tests and procedures and equipment approved to be covered through Medicare than what it is through the private health insurance companies like the Highmarks and the Capitals and the Humanities and the Geisers. So, double-edged sword for doctors. They don't like what they get paid, but it's so easy, sometimes too easy, but then they get things approved and covered. That's why there's a lot of Medicare fraud out there. Okay? Any questions about the A and the B? All right. So what I tell people who are going to remain on group health insurance plans is, makes sense, get the Part A. But why don't you wait to get the Part B until after you leave the employer plan? Because if you got the A and the B both together, it would be secondary behind the group plan. When you're paying $148 a month for something that's just going to be secondary behind the group plan, it's a waste of money. More important than that is, down the road, when you do get Medicare Part B for the first time, you have a golden ticket, I call it, where I can get you these things called supplementary advantage plans, and I'm not allowed to ask you any health questions, pre-existing conditions, about using anything. You're saving that golden ticket until you need to use it. That's the two reasons you wait on Part B if you're on employer plan instead. Understand? Any questions about the Part A and the Part B? Okay. Now we're going to enter the part that talks about all that mail that you get. All the TV ads that are just really creepy. Phone calls you're not supposed to be getting yet. There's a lot of companies, over 100 across the country, trying to sell you insurance whose job it will be to cover the co-payments and deductibles that Medicare A and B do not. Some cover dental vision, some cover drugs. But that's all they're there to do, is to cover what it is that the A and the B do not. The deductible, if you go to a hospital maybe multiple times. The days if you need skilled care beyond 20. The 20% of Part B. They'll cover drugs, some do dental vision. And we know this. AARP, which is United Healthcare. Mutual of Omaha, Highmark Blue Shield, Capital Blue Cross, Health America, which is now Aetna, Geisinger, Cigna, lots of things. But here's as easy as I can make it for you. Medicare regulates all of them, no matter who they are. They tell these companies what they're allowed to offer to go on with Medicare A and B. And as such, Medicare only permits 2 different insurances. Period. 2. That's all there is. I mean, how many different ways is it to cover 20%? Right? These companies don't want you to realize they're all the same because it doesn't make you special. When your time comes to go on Medicare, you're only going to have 2 choices, 1 or 2 choices to make. First choice that you have is you'll let your Medicare Part A and Part B, you'll let it remain your primary or first insurance. This little red and blue card that you get will be the card that doctors deal with to get things approved and covered. Now, when you get this card, it's not even as thick as this. They don't spend a lot of money on it for $148.50. You are permitted to laminate it.
You are.
I have a machine specifically for that. You can get extras, but it's beat up. But that card will be the actual card you use for doctors or hospitals, wherever you go. And then you buy something called a Medicare Supplement. You heard that term, Medicare Supplement. It's also referred to sometimes as a Medigap plan, but it means exactly the same thing. Now we look at this chart, the green and blue one. Medicare Supplement. As the names imply, its job is to supplement your Medicare A and B or fill in the gaps that A and B doesn't. In other words, it goes second. So no matter what company you pick for your supplement, it doesn't matter. It's the Medicare Part A and Part B that the doctors deal with to get things approved and covered. When Medicare is done paying their 80%, Medicare sends the remainder of the bill to whoever you pick for your supplement, and they've got to pay the rest. They have no choice. Doctors don't even deal with the supplement. They only deal with Medicare. If Medicare says yes to the 80%, supplement's got to say yes to the 20%. Now, there's many companies that offer these as well. The names that you might hear about most in our area, you'll hear United Healthcare, which is AR. Aetna, Cigna, Highmark, Thrivent, Manhattan Life, there's a bunch. But they all have to work exactly the same. They're not allowed to be any different. Now, this chart, you look at the top row in the chart. Supplements are further broken down into what's called plan types. If you get a supplement, they're going to go anywhere from a plan A to a plan F. Now, the F and the C are basically, they were eliminated in January. So unless you were grandfathered into Medicare form, you can't even get an F or a C. That's why they're all set. I've always liked the plan G best. But my point is, you pick one of those plan types. It doesn't matter what company you're with. Plan G is a plan G is a plan G. It works exactly the same. The trick is, they don't all have to charge the same way. You charge your rates based upon their claims experience. We're going to be lumped into categories. Some of us are from further, east, but in central Pennsylvania or western PA, that's the three areas they look at. The four things they look at when they decide what group they're going to put you into is the zip code you live in. Right here, where you are right now, is 17602, Lancaster. We're considered part of central Pennsylvania. Our rates are going to be pretty good. If you live closer to Pittsburgh or Philadelphia, Chester, Montgomery County, or out west, then you're going to pay a little bit more. Sorry about that. Gender. Men do pay a little bit more than women do. At this point, through Medicare, there's not a blended rate yet. That's probably coming down the road, who knows. Tobacco use. Obviously, if you're a tobacco user, you'll be asked to pay more for your supplement. Except for when you're new to Medicare the first time, I'm not even allowed to ask that question. If you start smoking after you got the application, they can never come back and start charging you more later. Right? Okay. And then finally, it's zip code, age, gender, and tobacco use. Now, in our area, just kind of give you an idea of pricing. For a male in our area, 65 to 69, you're probably looking about $124, $125 a month for a decent plan G. For a female, it's about 110. So essentially, between that 148.50 and the 124 for the supplement, I now have insurance that goes nationwide. The only thing the G doesn't cover is that first $203 deductible once a year. So I have insurance that goes nationwide. I'm responsible just once a year for that first $203. After that, I'll never have any bills for doctor's visits, for surgeries, for hospital stays, for new body parts, any kind of durable medical equipment, anything, ever. And once I'm in my supplement, I'm in it. They can never kick me out because I get sick and use it a lot. They can never raise my rates because I get sick and use it a lot. They can only raise my rates because I get older. and because of the overall claims in the group that I'm put into. Men in central Pennsylvania. Now, if you like your supplement and you do nothing, it automatically re-enrolls every January. You don't need to go through this every year. There's some people I see when they turn 65, they never see them again. We'll talk on the phone, we can do some stuff online, but we don't ever physically have to write another policy. Now, if down the road, the company I got my supplement with, I started at $124 a month. But now, 5 years, it's $180. It went up due to my age and because of the group that I'm in, it had a lot of claims. I think it's kind of high now. So I go and look for another supplement. I'm allowed to any time of the year. I can find a plan G for a guy my age in this area. It's $150 a month. Well, it's cheaper. I'll go for it. But the new company will ask 8 to 10 health questions. Go back to your history. And if I have a serious illness, they can say, no, we don't want you. Or we'll take you, but instead of $150, we'll charge you $360 a month. I'm going to stay put where I am, right? And if I'm a tobacco user, if I replace that plan, now I got to answer that question too. So some people never change their supplements. But if the rate get too high and they're healthy enough, then switch people. It's on rate. This is the best insurance you're ever going to have because there are no networks. I can go anywhere in the country I want to. I can go to Johns Hopkins down in Baltimore if I need to. I can go to Mayo in Minnesota, whatever I need. But there's 2 things that it doesn't. Medicare A and B, or the supplement, doesn't cover my routine dental vision. I can get a separate dental plan for that if I feel it's worth the price. More importantly, it doesn't cover my drugs. So what do I do to get my prescription meds covered under the Part A and Part B? I get what's called a Part D drug plan with the Part D chart. D for drugs. You like to think the government was smart when they decided to do this. They called D for drugs. Now it just happened to be the next letter they had. They got lucky this time, right? So we'll go with it. D for drugs. I find you a Part D drug plan. Now, everything I'm talking about right now, you can all do on your own. You can utilize a guy like me, it doesn't cost you a penny more or less. What I do for my people, you can do it yourself, is I use Medicare's official website. Write this down. Medicare.gov. Seems simple. I'll tell you right now, don't ever screw up and go to Medicare.com. That's not owned by Medicare. And you actually put your information on that website, you think your phone rings a lot now. You just wait. And it'll ring within minutes. Minutes. Medicare.gov, that's where you go. So it's going to ask me, what do you want to do? You want to find drug and health plans. It's going to ask me your zip code. And it's going to ask me to input a complete list of your medications. Name of the drug, the dose that you take, how many times a day you take it. It's a pretty slick site in that, like, you take a drug, it's hard to pronounce or say. Hydrochlorothiazide. That's a mouthful, and especially the spell. Well, I go into this website, and in a little block, I start typing hydro. Well, it gives me all the drugs that have hydro in it. Oh, there it is. I click on it. That'll screw it up. The next screen says, well, what's your dosage? How many micrograms do you take? 30, 40, whatever. Then it's going to ask, how many times a day do I take it? 1. Okay, 30 a month. Cool. And I compile a list. So I move on. Next screen says, okay, what pharmacies do you like? I always check that block that says mail order, because some drugs I can get to the mail. CVS, I can do Walmart, I can do Wise, I can do wherever I'd like to go. I can do multiple pharmacies. And then what this website does for us is it compares, this year, there's 31 different Part D plans. It compares all 31 drug plans and ranks them in order as which one would be the most cost-effective for me for this year. It looks at the drug and what the copay would be. It looks at the monthly premium of the plan that I select. It adds these numbers up just like that. Tell me which one for this coming year is the most cost-effective. Now, this is the time of year coming up, October 15th to December 7th, and I started doing the homework with people. There's 22 plans for 2022. But it still works out the same. And I simply tell people, hey, look, here's the report. I send them a list of their meds so they can make sure I can screw up. I send them all the top 10 plans and then details of the most preferred plan. Hey, look, this is what Medicare tells us. What do you think? Okay, let's do this. Make the change. Now, I require my people, even though I might have seen them a dozen times, so look, you email me a complete list of your meds, name of the drug, the dose that you take, how many times you take. That way, if they come back to me in March and saying, well, this plan doesn't cover this drug, well, you never told me about that drug. I didn't know. At least that way I know that I didn't screw up, right? And if they want to sign up for it, I ask them to send me their Medicare card. You already have that. Well, you sending it to me again just kind of gives me confirmation that you want me to do this, and I actually do that enrollment on that website. It doesn't come in for that. So we can do that search. I do probably about 50, 60 of them just a season. Okay? You can do it yourself. Any questions about that? Part D plans, they range in monthly premium anywhere from $7.20 a month up to $110 a month based upon your specific list. Don't ever ask your friends what drug plan they have, because unless they take the exact same list that you take, it's probably bad advice. You have the $7.30. You have the silver script. It's going to $7.20. It's dropping 10 cents. Nice. Yeah. So anyhow, she has a plan that doesn't have a high monthly rate, the lowest actually. The first time in 15 years they actually have a plan less than $10 a month. Pretty sweet.
But I actually have another plan for $15.40. One's my husband's and one's mine.
Right. Well, but
Yeah.
they're different for a reason, right?
That's right, because of the different drugs.
But let's pick one you need, right? Because you go in your mouth. See how it works? Keep your mouth shut. I won't pick up. Unless you fall asleep. Now, she has the silver script Aetna plan. So she has the plan, and it covers some drugs really well. She's saving monthly money because she's not paying $40, $50 a month. Now, every drug plan, all of these drug plans have a formulary. Did you get a physical formulary, or did they say go online?
Online.
Okay, so they give you a formulary. That's a list of drugs that her plan covers. Now, every drug plan does not have to cover every drug. But what they must do, they got to cover at least one drug of every therapeutic class. They got to cover at least one drug that does diabetes, one drug for blood pressure, one drug for whatever. Now, she decides she has this plan. She's going to stay with it for January. In March, the doctor gives her a new med. She says to her doctor, my plan doesn't cover this med. You have the formulary, you take it to your doctor, they look at them all the time. And hey, doc, for this new blood pressure med I need, this is the page of all the blood pressure meds my plan covers. Doctor says, cool. Doctors don't know from plan to plan which plans cover what drugs, it's not their job. But he looks at this list, he goes, oh, okay, well, this one or two or three, they do exactly the same thing. We'll just switch to that one instead, no worries. Doctor may look at her and say, that drug that your plan, the ones they covered, they're a bunch of junk. You got to take the one I'm going to give you. With a letter from the doctor, and they do this all the time, you send it to the plan, and they get what's called a formulary exception, which for the remainder of the year, she can get that new drug added to her list for her current plan. Copays may be higher than what they would have been, but she still has it covered. Now, October 15th to December 7th next year, she can go on that website, find herself a new plan that does cover it well. That's how it works.
But her premium's not gonna go up for the rest of the year, like
No.
she's already paying $7.20.
Correct. So she's locked into that new rate all year. Now, there's 5 tiers that Medicare utilizes. Soon, well, there are actually 6 now. 1, cheapest drugs, preferred generic drugs, the cheapest of the cheap. Her plan might have no monthly premium. Tier 2 is non-preferred generics. They're cheap drugs, but you might have a $5 copay. she gets a new generic drug added to her list temporarily. And it might be a cheap drug, but they're gonna charge you $5 anyway, just because they had to add it for her. Then there's tier 3, which is preferred brand. Tier 4, which is a little bit more expensive, non-preferred brand. Tier 5, what's called a specialty med. It's a drug they gotta make specially for you, like a compound medication. There's a brand new tier 6. You see these more in the Advantage plans, we'll get to it in a bit. These are diabetic meds. Certain insulins, they're really cutting that price down. That falls in tier 6. Certain plans cover them amazingly good this year starting. Okay. That's how we pick Part B plans. So in this first scenario of the two, what I have for insurance is I have my Medicare A and B as my primary insurance. I have a supplement as secondary. Then I got a Part B plan just to cover my medications.
Question. You said with the supplemental plan, we can change at any time during
Yes.
the year. The drug plan, you cannot?
The drug plans or the Part C Advantage plans can only be changed October 15th to December 7th. Supplements, they don't have a part, notice they don't have a part associated with it. They're not an A, a B, a C, or a D, right? So that means that they're not mandatory, they're optional. You can change them any time of the year, health questions permit. What happens a lot of times with supplements is people tend to ask me to review it when they get the renewal, which is based on your anniversary date when we started it, rather than during the end of the year. Okay? That's the first choice that I have. Sounds like that's what she's got. Probably her husband too, right? Takes care of the supplement and drug plan.
We have supplement and a drug plan.
Correct. That's option
And then we
one.
have different drug plans.
Which is fine. It's expected.
Yeah.
Right. Now, option number 2. This is the one that Joe Namath likes to talk about. You know a lot about commercials, don't you? Usually it's not the football. These are called Part C, also referred to as Medicare Advantage plans. Medicare Advantage plans. Okay? This is the only other choice there is. What a Medicare Advantage plan is not is a Medicare Supplement. It does not go second to your Medicare A and B. Probably what it does is it takes over. It becomes your insurance. You're required to have Part A and Part B to even get an advantage. You still have to pay that $148.50 a month, but the Advantage plan takes over. It becomes your insurance. Why do people do this? Why do people sign up for Medicare A and B, pay the $148.50, but not use it? Frankly, the commercials never say this. A lot of agents who sell this never say this. Because a lot of people do this and they don't realize that's what they've done. They have no clue that Medicare A and B is not working anymore. Nobody tells them that. Exactly what happens. Say I picked Highmark Blue Shield for my Advantage. What happens is Highmark calls Medicare. It says, Medicare, starting January 1, we're going to cover, Tony, Medicare Part A and Part B, you're off the hook. Not a lot of people know that. Now, why do people who do know that still do get the Advantage plan? Why would I still get an Advantage plan? I probably would right now because of the company. But why are they called Advantage plans? What are you getting out of that? Well, number one, these plans love to advertise, and we know Joe. No monthly premium. You see all these commercials. No costs. I don't think they say free, but they'll say no cost a lot. Yeah, I can get a health insurance plan, a Medicare Advantage plan through Highmark Blue Shield or any other. And there's no monthly premium. How can I do that? How can I give any of you a health insurance plan? It doesn't cost anything. Well, you know, the answer is I can't. Nobody can. What happens is this. When I signed up for my Medicare A and B, they want $48.50. Medicare, right away, they're doing math in their head. They're trying to come up with an idea on average. What is it they have to spend in medical expenses for everybody that has the A and B? In any you get a group of people, there's some people who don't use it hardly at all. There's other people that use tens of thousands of dollars a month. Medicare wants to pay us all on an average, based upon central PA, based upon male, female, age. They come up with an idea of what on average does Medicare have to spend. Medicare's looking at me and saying, okay, we got that Medicare A and B, and we figure it's going to cost us about $800 a month on average. But Highmark Blue Shield called them up and says, no, we're taking over. We're going to become Tony's Insurance. We're going to save you, Medicare, that $800 a month. Medicare rates all of the companies that offer these advantage plans. They rate them anywhere from 1 to 5 stars based upon how well they perform. 1, customer satisfaction. Do the Tonys of the world have it? Are we able to get things approved and covered? 2, doctor satisfaction. Are my doctors able to deal with them and get things that they want done to them? Number 3, patient outcomes. Is Highmark Blue Shield giving me the care that I need to keep me healthy? Now, for those who got that big white Medicare and You book, it comes right from Medicare. It's a good book. It's kind of like a dictionary, though. You try to read it from the back, you're a lot more confused than what it's going. It's a great place to go for reference, but don't try to read it. The second half of that book is devoted to nothing more than giving you these ratings of all these advantage plans. Highmark, and I deal with many. I'm just using them as an example. Highmark does good. They get 4.5 out of 5 stars. But this is Medicare is banking on me costing about $800 a month, give or take. But because Highmark has taken over and 8 or 4.5 out of 5 stars, Medicare says, Highmark will pay you $450 a month to cover to us. We don't have to. Highmark's getting $100 from star they earned. What I just said was, Medicare is buying insurance for me through Highmark at a rate that's cheaper than they've got a company on their own. So when Highmark looks at me and says, Tony, your monthly premium is 0, what they really ought to say, to be honest, we're just not going to charge you anything more than we're already getting from Medicare. I still have to pay that $148.50 for my Part B. That's not working anymore. Where's that money going? That's part of the $450 that Medicare is sending to Highmark. So Joe or Jimmy Walker now and Mike Ditka, I think, when they look at you on TV and say, your plan doesn't cost you anything, what they ought to say, to be honest, is it just doesn't cost you anything more than the $148.50 a month and you forfeit your Medicare. That's what it costs to be in an advantage plan. That's not nearly as sexy to say it that way. It doesn't drive the business. That's how they work. Now, even knowing that, I might get an advantage plan anyway. I mean, after all, what are the advantages? Well, number 1, there is no additional monthly premium. So I'm only paying the $148.50. That's kind of nice. These plans, no matter who they're with, they're designed to keep me healthy because the healthier I stay, the less it's going to cost them in medical bills. So they're going to give me tools whose job it will be to keep me healthy because the healthier I stay, the cheaper I'm going to be to fix them up. My Part D drug plan is included. I don't need a separate plan for drugs. They know if I take my blood pressure med, that should be known if I didn't. Give me double this time of year. That's the point. And so that's why they cover my drugs too. I get free wellness benefits. Programs that if I choose to participate are designed to keep me healthy because the healthier I stay, the cheaper I'm going to be to fix it. My problem. They'll give me programs that if I want to stop smoking, if I want to stop drinking, I want to stop doing drugs, I will stop having any kind of fun at all. I think about that. I don't think that. If I want to lose weight, I have mental health issues, I have diabetes. Programs that if I choose to participate are designed to keep me healthy because the healthier I stay, the cheaper I'm going to be for my life.
Gym memberships.
I'll get there. Get excited. Free preventative services. All my regular screenings and tests are free because they know if I catch an issue early on, it'll be cheaper to fix me up if they find a problem. These plans have no annual deductibles at all. 0, not even $203. And yes, they give me a free gym membership. It's called Silver Sneakers. Matches our hair, right? they'll pay for us to join a gym, because if I go to a gym and do something while I'm there, I'm sure they help me if I didn't. Right? Okay, that's the key, you gotta do something. These plans have emergency care worldwide. And they give me $75 every 3 months towards over-the-counter benefits like vitamins and headache pills and what. And a lot of these plans give me a decent dental, vision, hearing plan. What are the trade-offs? What are you giving up by leaving Medicare and a supplement and going to an Advantage plan? Unlike Medicare and a supplement that lets you go to any doctor anywhere in the country, Advantage plans have networks called PPOs or HMOs. We've got to be careful that we put you into one that's going to let you go to the doctors and hospitals you like. When you call these 800 numbers, you might get California, you might get Florida. They're putting you into a plan they know is in this area. It doesn't necessarily mean it covers your doctors well.
Don't most of them though do cover? They don't.
No, there's one company in particular I will refuse to deal with because specialists just won't use it. Now, if I put somebody into a plan and they've got problems with the doctors and the hospitals they try to see, guess what? They're calling me and now I got problems. So I'm not going to pick plans I know that will cause problems. Not all work all places. So you got to be careful who you pick. Also, these plans, whereas there's no monthly premium other than the $148.50, and there's no deductible, I do have co-payments now every time I go use it. Whereas those commercials tout free this or no cost that, no cost this. To have insurance, there's no extra cost, but there's insurance cost when I use it. Now the co-payments might not be much. $5 for family doctor visit, $35 for a specialist. $395 when I go to the hospital. That $395 includes everything, regardless of how long. Pretty good. So I have co-pays when I use it. So the two trains of thought are, I pick my plan. Do I want to pay more each month? Not have any networks, not have any bills other than the deductible? Or do I save my monthly money on co-pays when I use it? That's the two trains of thought. Now, every fall, you have the opportunity to make changes if you wish. If you're in a Medicare and a supplement and a drug plan, and you decide that you want to go to an Advantage plan, Advantage plans are never allowed to ask any health questions. It's easy to do. What if you got an Advantage plan with that one company that I won't talk about, that I don't handle, and you realize Tony was right, specialists don't take it. Can I get out of it into something else? Sure, we went to October 15th to December 7th. We go with the new plan, and the new plan cannot ask any health questions for pre-existing conditions. The problem that some have is they're in an Advantage plan, and then they decide 4 or 5 years down the road, I want to go back into Medicare and a supplement now. We still wait till October 15th to December 7th. Drop the Advantage plan. Automatically, that Part A and Part B kick back in again as my primary insurance. No questions asked. I can get you a Part B drug plan based upon your meds, no questions asked. And now the Medicare supplement, because you're no longer doing the Medicare, will ask you 8 to 10 health questions. Look back to your list. You can say, no, we don't want you. Or, in the case you've got healthcare, one of the reasons I have them is because they'll say, you know what, we know you need chemo, we'll take you, but instead of $120 a month, we're going to charge you $360. They give you an option. But it's more difficult to get into a supplement than it is to get into an Advantage plan. Understand? You can do it. There's a lot of companies that say you can't do it at all. That's not true. And depending on who you call, on that 800 number, Geisler's company I have, but they only do Advantage plans. You call them, that's all you hear about. You don't even get to hear about supplements and drug plans. Or in the same respect, you call you call Mutual of Omaha. They don't do Advantage plans. You're only hearing about supplements. You don't even know half the story. So part of what I do, and it's very similar to what you just heard, my job is I see a lot of people who work at our employers that when they're looking to retire, I get to see them when they're new to Medicare. I try to say, look, don't worry about the needs of the companies. Don't worry about these bells and whistles and who's talking about what. Don't worry about what your friends have. There's only 2 kinds of plans you you can even get in the hold of Medicare. Supplements and drug plans or advantage plans, period. Once you figure out which one suits you better, then we can drill down to the supplement that has the best and most stable rate, and the drug plan that's pertinent to your list of drugs, or we make sure we have an advantage plan that matches your list of doctors and hospitals and covers your meds. Simple as that. There's only two choices anybody has ever had. So don't buy into the hype or the propaganda. It's not that confusing, not nearly as confusing as these companies want you to think. And that's all I have to say about that. So any questions anybody has, feel free. Now you all have a card of mine too, so if something pops up, something that's a little personal you want to ask from the crew or the family, feel free to send me an email, give me a call. Yes.
I know the question. I'm still working full time and I signed up for Medicare Part A a couple years ago. Never had to use it. I signed up for that using my Social Security website. So I went back to my Social Security website thinking I could now add B for when I'm retired in a couple months.
Cannot do that.
I couldn't, so I don't know how to sign up for B.
Well, the website is designed to get A and B or A. If you got A and you need to get the B now, there's two specific Medicare forms you need. I have them electronic. Send me an email. I'll send them to you tomorrow. Two forms. First form, you fill it out. Put the information that's on your Part A card down. That's it. In the remarks section, you tell Medicare, I want my Medicare Part B to start. You pick the first of whatever month you want. That's the first calculation right now. But you can do December, January, whatever. The second form, this has to do with that late penalty. Medicare wants to charge you that 10% extra for every year you waited, unless you can prove to them you've got other credible insurance. That other form goes right to your HR department.
Oh, they already sent that. I have one.
Well, then you have them. So then once HR fills that out and gives it back, those two forms get sent to Social Security. That's what triggers your Part B enrollment.
I don't think I have, I just have that one.
Well, just send me an email and I'll send you whatever one you want, or I'll send them both.
And then I mail them to.
You can. I suggest you fax them.
Yeah, I don't trust them.
Exactly. I have a fax number, read fax to Social Security.
Thank you.
You bet. Good question. Go ahead.
Yeah, I'm kind of in the same situation that she is in that I was 65 last year. I continued to work. I have insurance with my employer. So I'm planning to retire at the end of the year. And I haven't signed up for A or B. I went in and kind of got the process started, but I, went back with the number that I can go back in. So I would apply for A and B together.
Okay.
Do I have to know what plan when I'm?
No, you don't even think about that yet.
Okay.
You got to, so what happens is once you do that, it triggers them to assign you a Medicare number. It's a mismatch of 10 letters and numbers. You can't even pick a supplement or advantage plan, you even know that number is.
Okay.
So that comes later.
So I need to do that, yeah. I want to get there, what else is opportunity?
No problem.
Medigap.
That's a supplement.
Okay. So
Medicare
I wanna make
supplements
sure,
and Medigap means
I
the
didn't hear
same.
that word at all, I'm thinking it's a supplement, the same thing.
Medicare.
Medigap.
Medicare calls it Medigap, plus normal people call it supplements.
Okay.
They mean the same thing.
Okay. Very good.
Anything else? Any questions from Zoom?
Any questions? Jordan?
Steve Peachy just wanted to note that there was a steep penalty for married filing separate if the income is too high.
Well, look at that chart. That chart will tell you why. Because they look at two benchmarks. They look at individual income if you file that way, or joint income if you file that way. Odds are probably it's a steep penalty for one of you, but not for the other. But look at what it would be if you combine the two.
It's a CPA.
Some people, I've had people who actually contemplated, I don't know if they've ever done it, they contemplated divorcing just so they would have better rates. I don't know. Yeah, sometimes depending on your income level, it can make a difference. Anything else?
Any other questions?
All right, well, always remember, I'm just a phone call or email away. Feel free to ask whatever questions you have, even if it's for parents. We help our parents and stuff like that sometimes. And they don't know how this works.
I have a question.
Yes,
If you get a Medicare Part D for the drugs,
correct.
and is that something you need to sort of check out every year, because sometimes they may stop covering the drug that
Well, what happens when you have a Part D plan, by the end of September, you get what's called an annual notice of change booklet. And it explains to you what, if anything, the plan is changing for 2021. It could be, 2022. It could be the monthly premium is changing. In her case, it's actually going down 10 cents. It could be they're not going to cover certain drugs. It could be they're raising the deductible. It could be they're going away altogether. So that booklet is usually the alert to some people to say, okay, now it's time for me to review it. I always tell my people, I'm of the opinion, if it ain't broke, don't fix it. Because you chase a bell and a whistle here or there, you're giving up something somewhere else. So that booklet is usually the determinant if, you need to make a change. Okay? Too bad.
I do have one more.
Sure.
Because you indicated that little asterisk, Plan G or Plan N are typically very popular, very good.
I didn't say the end, but you're right.
Oh, did you say that?
No, I said G. You're right, but G, I
I
didn't
thought
say
you
that.
said on N, because I also.
No, I didn't say that. But you're probably thinking what I was, probably reading what I was thinking.
Well, I'd like to know, I see that this Part B excess charges is marked under Plan G. What is really the difference between those two?
Well, see, the end is less expensive per month. The end,
The premiums are lower.
Yes. You do, with the end, you do have co-payments for doctor's visits of $20.
So if you don't go to the doctors a lot, that might be the better plan. And then
Could be. You also pay $50 for an ER visit. Now, what excess charges means is you go to your doctor, you get your gallbladder, he wants to charge $15,000. So it goes to Medicare first. Medicare says, no, you only pay $12,000 for a gallbladder. In some states, including ours, that's all the doctor can charge. There are other states, including a lot that surround us. We go to Johns Hopkins in Maryland, for example. That doctor can say, you know what? I'll take that $12,000, but I can balance bill this person a percentage of that $3,000 short. That's balance billing. That's something that would cover that. Our state is not relevant, but a lot of states it is. That.
Plan N doesn't cover that excess.
And I gotta say, there's a lot of even states that can, most doctors don't. But they can. You bet.
Any other questions? And if not, if you have his email, you can always email him. I personally, and like he said, he's helping out. It's very, I call him the grocery store. I think he returned my call to the grocery store. I was so impressed with how Tony handled things, so professional. But for me personally, I was thankful to have somebody who knew the ins and outs and how to get around this. So to me, but again, there's a lot of other people out there. We just felt like it's really great to have this as an option for you guys to learn some more information. So Tony, thank you.
Pleasure.
You did a wonderful job.
So I'm here.
He's located here.
Yeah, this is
And
what
then-
I'm looking at.
Yeah, and I also want to thank Sharon. Sharon is like the right and left arm of me. So I just want to say thank you, Sharon.
Thank you.
And Jordan, those two, they take off.
Any of the tech.
And Jordan for
It's
tech
Jordan.
support.
Yeah, so thank you both, Matt
Thank
and I. It makes our life so easy. We just show up.
I just sold the door.
We'll stick around for a little, but this has been recorded, so our goal is to get it on the website, so don't go to my kids. But you're welcome to come eat food, so we don't have to take it home. Thank you.
Thank you, Jordan.
And I found out the other two.
Oh, no.
I was.
Oh,